Here at Marsden State High School. I've just met the school leaders for next year. They're very excited that we're here today, and this is one of Queensland's largest state high schools. So very happy to be here, but I want to talk in a moment about the low vaccination rates in Logan. And I'm here today with the Chief Health Officer, the Health Minister, the Treasurer, the Attorney General and local members and the Mayor, because we are all here for one purpose, and that is to lift the vaccination rates in Logan. That is exactly why I'm here. You would have seen me travelling across regional Queensland, but I am concerned about Logan, so I'll talk to you about that in a moment. But in good news today, 0 community cases. So once again, Queensland, fantastic effort. But we've had 5 cases of people coming in from overseas that have been detected in hotel quarantine. So we are seeing those numbers increase again. So there's 5 of those. We've had 6,330 tests in the past 24 hours, and Queensland Health has administered 15,681 vaccines yesterday. Now, of course, we also have our GPs and our pharmacists that are also administering vaccines. And yesterday we were told that the combined total was around 50,000. So that's excellent news, but we want to keep this momentum going, Queensland. We really need to push up those vaccination rates. So for first dose, we have 73.66% and 58.72% are fully vaccinated. And as we said yesterday, we've got that one community case. The gentleman in his 30s is very ill in hospital. Dr. Young will talk a little bit more about that, and he was infectious in the community. We've listed some exposure sites. One is in my electorate, where he went to a barber shop in Richlands. So I'm encouraging people in Richlands and Inala, if you have any symptoms whatsoever, to please go and get tested. He also went to see a movie at Stafford. So Dr. Young will give you those times. And once again, too, we want to make sure that the people who've been told to stay home and isolate are doing that. It's absolutely critical. And of course, this gentleman was unvaccinated. He is a fit man in his 30s. This is why it is critical that people get vaccinated. And on the Gold Coast, again, can I please urge people on the Gold Coast to get vaccinated, and if you have any symptoms whatsoever, to get tested. Now, tomorrow, of course, we have our Super Saturday vaccination blitz, and we have over 100 schools now that are going to be open tomorrow from 9 a.m. to 2 p.m, and they are walk-ins. So not only can they vaccinate students, but they are there to vaccinate families. Make it a family day out and come and get vaccinated. Now, I'm here at Marsden today, and I have a very clear message for people who are living in Marsden and Crestmead. Your vaccination rates are not where I want them to be. At the moment, they are 54.7%, so they are trailing the state average. Remember, I said the state average now are at 73.66%, and you have second dose only 36%. Now, what does this mean? This means that your community is exposed. So if you live in the Marsden Crestmead area, come down to the local high school. That is why we're here today. Come here and get vaccinated. Now, in Logan, our first dose rates are 66.1%, 47.1% second dose. I have 87,745 residents who live in Logan who are currently unvaccinated. Please come and get vaccinated this weekend. You can go to the schools that are listed, you can go to your GPs during the week, and you can go to your pharmacies. We really want to see as many people vaccinated as possible. Then we have Browns Plains, 64.7% first dose. We need to increase the numbers there. Jimboomba and Flagstone are at 63.4% first dose. Waterford's at 67 and Yarrabilba is at 65. So, Logan, this is a wake-up call. Come and get vaccinated. There is no excuse. I have been visiting vaccination centres with Dr. Young and the Treasurer. My ministers have been right across the length and breadth of Queensland, and people are coming in droves. It is so easy to do. It doesn't hurt. It takes very little time. Bring your family, bring your friends. It is absolutely critical we have You know, we have few days to go until we get to that window where people will not be immunised, so we need to make sure that people go and do that as quickly as possible. There's also the Logan Entertainment Centre Vax Hub, and they're open Monday to Friday 9 to 4:30 and Saturday and Sunday 7:30 to 4:30, and they can also do a lot of vaccinations. All right, so with those few words, I'll hand over to Dr. Young. Thank you.
Thank you, Premier. So no new community cases in Queensland overnight, but we do have another truck driver. So he's now currently in Victoria, but he tested positive on the 20th of October and was here infectious in our community on the 18th and 19th of October, and we've already put up some venues that he's been at. So it's really, really important. We know we can get virus in our community at any point of time, so the protection to that is to just get vaccinated, because we don't know when we'll have our next case. So this truck driver had one dose of the vaccine on the 1st of October, but that's not sufficient to stop someone spreading the virus, so we know that's a risk. Now, our gentleman down at the Gold Coast, I'm sorry that I have to report that he's very unwell. So they're keeping a very close eye on him. He's on high flow oxygen and he'll probably need to go into intensive care. That is terrible. He is a very young, fit man who was not vaccinated, and he is now extremely sick. So the best thing we can all do to protect ourselves is to get vaccinated so we don't end up in that situation. Now, he was so sick that he probably has not been out in the community, so we don't have exposure venues for him other than his place of residence. So anyone who lives there has been told any symptoms at all to get tested, but we believe they're only casual contacts because he's been so sick he's been at home. So it is really important, though, don't end up as he unfortunately has. Make sure you get vaccinated. And today in Queensland, down here in the southeast corner, it's unfortunate, but we have 675,000 people not yet vaccinated. We've got some reasonable percentages, but that's not enough. It's actual numbers as well that will cause us a problem. You can imagine 675,000 people who are at risk of getting infected and ending up very sick in our hospitals. So please, anyone who lives anywhere in the state, if you haven't had that first dose, your time is really running out. You need to come forward and get vaccinated. So this weekend there are 100 schools across the state, at least 100 schools across the state that will be open on Saturday. And they're not just for the school kids in those schools, they're for their parents, their families, their neighbours, their grandparents, their friends. So I'm putting out a challenge here to Marsden State School. I've just had a chat to a few of the kids and I think they're up to it. I want every single one of you, there's 3,000 of you, go and find someone who's not vaccinated and get them to come to your school and get vaccinated, because that will protect you and your community. And also it'll protect your Christmas holidays. Who wants to have COVID in Queensland over Christmas, New Year? I certainly don't. So everyone, just go and get vaccinated over this weekend. You can come to one of those schools, you can come to one of our mass vaccination centres, you can go to a pharmacy. And while driving here, I saw pharmacies with big signs up, come and get vaccinated in their pharmacy. You can go to a GP. There are so many places you can go. Go to wherever you're comfortable to go to. It won't cost you, no matter where you turn up to get vaccinated, and get that first dose. Then 3 weeks later, get your second dose of Pfizer. 4 weeks later, get your second dose of Moderna, and then 2 weeks after that, you're protected. And that's so important, it really is. So please, every single Queenslander, 12 years of age or older, this is the weekend, or today is the day to get vaccinated. Thank you.
So we actually have now 116 schools that are going to participate in Super School Saturday. So there is no reason to come out and get vaccinated this Saturday. To every one of those school students who are 12 and above, come out, Bring your siblings, bring your parents, bring your grandparents, bring your friends and bring your neighbours to your local school that's vaccinating on Saturday. I also want to do a shout out particularly for our Year 12s and their parents. If you are planning on going to schoolies, which starts from the 20th of November, you need to take advantage of this Super School Saturday. You need to come out tomorrow and get vaccinated so that you can have full protection before you go on schoolies. Please make sure that we are protecting all of our community and your friends and your family. If you are Year 12, make sure you get vaccinated this weekend. But of course, we want all school students in high schools coming out this weekend as well. I can also advise that there's 4 schools that will be open from 3 to 5 this afternoon that will also be available for the school, the students, the teachers, the volunteers and parents to come get vaccinated. That's Kelvin Grove State High School, Bray Park, Cleveland District and Aldridge State High School. So if you go to those schools or you live in those areas, you can come out 3 to 5 this afternoon and get vaccinated as well. As the Chief Health Officer said, we've got around 600,000 people in Brisbane across southeast Queensland who are still not vaccinated. So don't wait any longer. There's so many choices to get vaccinated now, including this weekend. Please come out and get vaccinated. The Premier also mentioned some exposure sites. So Acacia Ridge, Richlands and Stafford. These are where this truck driver has been on the 18th and 19th of October. So please, if you live in these areas or have visited these areas, check the website for these exposure sites and the times to see if you are a close contact and follow the advice on our website or contact Queensland Health in relation to what to do. Come on, Queensland, we need to get vaccinated. Don't wait any longer. We are hitting our 70% fully vaccinated and our 80% targets really soon. We need our community protected. We need to support our health workers. We need to look after the most vulnerable in the community. And there's only one way to do that, and that is for you to come out and get vaccinated this weekend.
As the recent Gold Coast case has demonstrated to us, the dangerous Delta variant of COVID-19 may no longer be on Queensland's doorstep. It may have stepped right inside. My message to the people of Logan in particular is very clear. The dangerous Delta variant of COVID-19 is coming to our city. It might be here in days, it might be here right now. Time is almost past. Time has almost run out. There is no time to wait. You must get vaccinated today. There is no time to wait. The only time we have now is for action. You must get vaccinated now.
What we love about Logan is that we look out for each other. We are a strong, connected community, and now is the time to look out for each other, keep yourselves safe, keep your family safe, and get vaccinated. It's wonderful that we're here at Marsden State High School, as we've heard, one of our biggest schools. To the 3,000 students, I know school might not be the best place to be on a Saturday, but it will mean, as the Chief Health Officer said, you can have a wonderful Christmas holidays because the community will be safe. So come on, Logan, we've got to get vaccinated. It will be quick, safe and easy to go to your local high school on the weekend. It's not just here at Marsden State High, Mabel Park, Logan Lee State High. Go to your local high school and keep your friends, your family, your community in Logan safe.
Good morning. I'd just like to thank the state government for coming here today, because obviously this is a big concern for me as Mayor. We've got 130 locations in Logan open to get vaccinated, so residents are running out of excuses. I want to address this. Don't get your advice from Facebook. Get it from health officials. Please. There's 3 groups of people I want to also call out. Our Pacific Islanders in Logan, our Indigenous people and our pregnant women. Please get vaccinated now before it's too late. These 3 areas are my major concern at the moment, and my council will be doing everything we can to get in touch with these people. Thank you very much.
The truckie, why is he not considered a community case if he was out in the community for 2 days while he was
Because he's come from interstate.
So
Yeah.
he was infected in Victoria? Or aware of.
Yeah, that's what's happened in the past too.
Just to
Yep.
clarify, the
Yep.
cinema, the barber, and
Yes, that's the truck driver.
that's the truck driver,
Yes,
not that
yes,
Gold Coast bloke.
yes,
Yeah, okay.
yes.
And
Yep.
the unvaccinated, the guy in hospital,
Yes.
has his condition deteriorated in the last 24
My
hours?
understanding is yes, he's very, very unwell. Very unwell.
So, from what Dr. Young said, he's basically not been out of the community. Is that the case?
They can't get further information because he is so sick. So, the authorities are trying to get information when he's well enough. So it's a wait and see. So that's why it's really important, if anyone has any symptoms whatsoever, to get vaccinated. And come on, Queensland, we've got 9 days to go to get people vaccinated. So there's no excuse. There's a lot of places to get your vaccine. There's ample supply, and time is of the essence.
The New South Wales and Qantas have announced the recommencement of international.
Yes.
When might Queensland receive international tourists without them having to go into quarantine?
Well, I'll address that in two parts. The first part is that New South Wales vaccination rates are now over 90%. And in our roadmap, we have said that that would be the situation when we hit 90%. So New South Wales has had the virus through their community, and their vaccination rates are really high. Secondly, National Cabinet has not made any of those decisions. There was supposed to be a trial. Obviously, the Prime Minister and the New South Wales Premier have made those announcements today. We will look at that very closely. But as we are seeing today, very clear example, 5 cases in hotel quarantine. So Queensland does not have the protection yet that it needs to be able to have quarantine-free vaccinated people staying in Queensland.
One from left field, sorry.
Yeah.
The Broncos have the lowest vaccination rate of any NRL team at 65% first dose. What would you be saying?
I would be saying become community role models and leaders and go and get vaccinated.
Do we know any more from you about how this Gold Coast man crossed the border?
No, the police are doing those investigations, and they'll update the public when they see fit.
Premier, why are vaccination numbers lower this week than they were last week, given you've been on this huge regional tour?
Well, what we're seeing is we're getting the message out, and it's been great to have everyone across regional Queensland. I've had people up into remote communities. As you heard earlier, I was talking before, the Attorney General's been right up to the Torres Strait, because we know how important it is to get the Torres Strait Islander people vaccinated as well, being such close proximity to Papua New Guinea. So I want to see a massive uptake, and like I've said too, when you combine it with the numbers with the GPs and with the pharmacies, the numbers are actually increasing, like 50,000 yesterday.
Are you concerned about the loss of economic benefit, given that people are going to be able to, from overseas, are going to be able to travel into Victoria and New South Wales before Queensland?
Lydia, it's unsafe for people to do that into Queensland at the moment. Our vaccination rates are not high enough. We're not even at 70% double dose. We have set out a very clear roadmap. You know, we need people to come forward and get vaccinated. We have not had the situations that New South Wales and Victoria have, where tragically we are seeing numbers of people who have lost their life each and every day. We haven't had that. But now is the time. We've got that window of opportunity for Queenslanders to get vaccinated.
And given we had all that extra vaccine supply come in September, do you think your government should have done this vaccine tour a month ago?
We've been out there speaking about vaccines, I think, nearly every single day.
I mean, the more
Yes.
cases of what seem unfair investigations by the Office of Independent Assessor in the country, have they overstepped?
Look, thanks for that question, Elaine. That's a very good question. I've had a conversation with the Deputy Premier, and the Deputy Premier and I feel that it is time to refer those complaints to a parliamentary committee to conduct an inquiry. The Deputy Premier will be finalising those terms of reference, and he'll be having more to say about that matter in the coming days.
So will they look at the complaints themselves?
Yes, they will look at the number of complaints and the types and range of complaints that have been made.
Will they look at the investigations as to why they were carried out in the first place?
Yes, they will. That is the proper process to have the parliamentary committee. This is an independent body to let the parliamentary committee look at all of those issues. So,
do you have confidence in the elements forum?
Yes, personally I do. I understand that there are matters currently before a committee. I'm not going to comment on that committee until that committee makes its report.
Would you be happy for him to serve another term if he's thought on?
I'm going to wait to see the results of that committee, and like I said, I can't comment on that.
Premier, the roadmap sets dates of when we're expected to reach 70% and 80%. When are we expected to reach 90% double dose?
Well, I like to see that as quickly as possible, and what we saw in New South Wales, we've seen that they've actually reached their targets earlier. So I'd like to see our targets reached earlier. That's why I'm encouraging everyone to come out and get vaccinated.
Do you think we'll hit it before New Year's Eve?
I don't know the answer to that. Let's see how we go with the 70% and let's see how we go with the 80%.
I've got a question for Dr. Young
Yep,
on
thank
First
you.
Nations vaccination, if that's okay. Community health services are meeting across Queensland today to discuss the impacts of COVID on Indigenous populations. What areas are you most concerned about and what measures are in place?
So it's all of our First Nations people across the whole state. It's not just those who live in those discrete communities. It's our First Nations people who live in our cities. It's everywhere. And it's really, really important to get out to them, and that's why that discussion is happening. So we've been working very closely with the leaders from the different communities to find out what would make a difference. So we know that they are more vulnerable to having severe disease, but we also know that usually more than 95% of their kids get vaccinated. So we're just trying to work out what is different here, because we need to work with them to get vaccinated.
Will those communities be isolated when the rest of the state reopens?
No, we don't intend going forward to do that. So that is why every single person needs to get vaccinated. The reason we had to isolate people and we had to lock down areas is because we had no other measures that we could use. Isolating people, requiring people to stay in their homes are very, very blunt tools. The vaccine is a far better tool, and we have it, and we have it throughout our state. It is everywhere. So there is absolutely no reason why anyone in Queensland today, 12 years of age or older, can't go and get vaccinated. So that's what people need to do.
The man in hospital, can you talk about how his condition is changing? And has he seen any family and friends who come forward while they're in isolation?
He lives by himself, so there's no one else in his household. So there was no one else that we needed to test as a close household contact. He's in hospital, in the Gold Coast University Hospital, and over the last 24 hours he's deteriorated, so he needs more oxygen.
So we know he was anti-vaccination, now he's in a very serious condition. I imagine that's quite disappointing for you to see?
I don't know his vaccination status, other than he hasn't been vaccinated. Yes. Yes. Sometimes people, if high flow oxygen is inadequate, then they need to go onto a ventilator.
A question for the attorney, if that's okay. Has there been any delays to the introduction of shield laws in Queensland?
So we've committed to introducing a bill to protect journalists and Queenslanders who come forward with important information by the end of the year. We've had extensive consultation with stakeholders. We're now working to incorporate all of that feedback into a draft bill, and we hope to introduce a bill in one of the upcoming sitting weeks.
Why is the Triple T being dealt with differently over here?
So because the PCCC has made recommendations about updating Chapters 3 and 4 to the Crime and Corruption Act, that's a separate body of work. We hope to deal with that next year. There will be some elements of the shield that will relate to CCC investigations, namely search warrants, but the CCC and the Crime and Corruption Act will be dealt with separately next year.
Too late for journalists then?
Well, look, this is about making sure we have protections in place for our courts. That's what happens in every other jurisdiction, and that's the commitment we made. And it is so important that Queenslanders who come forward with important information are protected.
Thanks, everyone.
Thank you.
Uh,